home at, you come back home around suppose 6, 4:30, 5:30. Then 6:30, your tummy is quite empty because you have taken lunch suppose at 1 o'clock, 1:30. Then 6:30 you can practice yoga for 1 hour, and then you can take your dinner at 8, 8:30. Suppose you have got a night duty. So whole night you are awake. So when you come home, you want to go to bed, and so you go to bed. So you get up 4 o'clock, 5 o'clock in the evening. So you can practice it at 6:30 again when your stomach is empty, and then you can take your food and go for the duty in the night. So this is where you have to plan. So basic principle: your stomach should be empty. If you have taken light food, at least 4 hours after food, and if you have taken heavy meal, then your stomach should be empty. You should feel that your stomach has become empty and you are feeling light. Then only you should practice, or at least minimum 6 to 7 hours, because that is the usual time taken by food to reach to the small intestine, get totally digested and get absorbed. So your all intestine, stomach, they become empty. So there is no pressure on it when you are practicing different yogic kriyas. Then yoga sadhana is not an exercise. It should be practiced yogic way and not with force. As a beginner, when you are practicing yoga, so if you are sitting in Vajrasan, all the students, and then one of you get a tingling numbness in the leg. So you say, oh, I'm getting tingling, what to do? So you look on the side, and as your side person is sitting comfortably, then you think, if I leave the Vajrasan, he will laugh at me. So you sit forcefully. And then what happens? Then you don't feel where your legs, because they have become totally numb. So you should practice according to your capacity. आपकी जितनी क्षमता है उस क्षमता के अनुसार आपको योग का अभ्यास करना है. You should not do it forcefully. Today, suppose you are able to sit for in Vajrasan for 5 minutes. Okay, sit only for 5 minutes. Slowly you go on increasing your capacity, and after suppose 1 month, 2 months, you might be able to sit for 15 minutes, 30 minutes like that. So similarly in Kriyas, when we teach Kapalbhati, you tell that maximum you can reach up to 100 or 120 strokes in one set. Like that, you have to make 3 sets. So on the first day beginning, you should not ask him to practice 100 strokes in one set. Let him practice 30 strokes, then 40, slowly go on increasing, and then he will reach up to 120. Similarly in asanas, you should not practice the final stage of asana on the very first day. Ardha Bhujangasana, Ardha Shalabhasana, then slowly go on increasing and then reach to the final stage of the Bhujangasana. So this way you should practice yoga. Then one should not practice one single asana or kriya, but whatever yoga module which is advised. Now you are going to become yoga teacher, yoga therapist. So sometimes some patient may come to you like that. See, I don't have time, I'm very busy. So you tell me only one asana and I will do it methodically, seriously every day without any problem. So don't entertain such type of request, because as we have seen, yoga has got a holistic approach. Whatever yoga module we prepare, it works at physical and mental level, and if the total package, if you practice it, it will help to improve the functioning of all organs of the body. So never entertain that only single kriya, single asana that will help. So make him, no, you have to practice this much. You have to do counseling and explaining why we have to do this minimum. Then one should not practice yoga. Just now I discussed that. So final stage on the very first day. When you are tired, you should not practice yoga. Then ladies should not practice yoga during menses. In pregnancy, should practice yoga under supervision of experienced yoga teacher. If now you are going to be yoga teacher, so in over enthusiasm, you still think, no, pregnancy and yoga is very important, so I will only practice that. And then tomorrow you will put the board and a yoga for pregnant women. Don't do that. Work with some senior teacher who is giving yoga practices to pregnant women for at least 5-10 years. Because pregnancy is very precious to the family. And any wrong practices given by you to the pregnant woman may lead to abortion. So, and then yoga may be blamed. So at least practice 5-10 years, at least 1 or 2 years with a teacher who is giving yoga practices for not less than 10 years. So he knows all the pros and cons. And then once you get well trained with him, then only you may go for the as a yoga therapist for pregnant women separately. Then one should not practice yoga by just reading the book or watching the television or somebody practicing it. Because when you see on TV, you remember 50%. When you start practicing yourself, you remember 50% of it. So it comes to 25%. And when you practice it, then you may do it only 10%. And then you will say, I practiced yoga, but then I didn't get any effect. So yoga will be blamed. So no half-hearted attempt should be made. So always tell the student that you should practice it under supervision of the yoga expert and not watching TV, not reading the book. But just another thing is that so many times they think just joining the yoga class will help you to get rid of diabetes, blood pressure. No, it is not like that. Because once you join the class, once you start practicing yoga regularly, then all these yogic kriyas will take charge of your body. The different organs, systems in the body, they will start functioning properly. And when they start functioning properly, then your insulin may secrete properly, so sugar level may come down, your diabetes may come under control. But you have to give time for that. So if he is joining the class, see that the consistency should be there and he should practice it every day. So these are the basic principles for them. Then for healthy people, now all you are practicing yoga and you are going to be yoga therapist, so you are 99%, I think you are all healthy. So you can practice the total module which is there, or whatever different yogic kriyas you have learned in the book, that you can practice yourself. But patient, that it should be decided as in per the individual patient's disease and his physics. So that you have to judge it. Then which patient can practice? So there are two types of conditions. One is acute condition and another is a chronic condition. So acute condition, no pathy works except allopathy. So any patient who is in acute condition should be treated by allopathy. Now, what are the acute conditions that we'll see in the next few slides? Patient should not practice whole of the yoga module on the very first day. Then
सर आम्हाला पीपीटी दिसत नाहीये ऍक्च्युली एक वर्ड डॉक्युमेंट दिसतंय
पीपीटी दिसत नाही आता ही स्लाइड दिसते का
नाही स्लाइड नाही दिसत आहे एक वर्ड डॉक्युमेंट तुमचं पर्सनल आहे ते दिसतंय आम्हाला
एक मिनिट पुन्हा अपलोड करतो एक मिनिट होल्ड करा आता दिसतंय
हो आता दिसतंय
आता एकदा पुन्हा वाचून घ्या मग मी पुढे जातो द वन विच आय डिस्कस जस्ट नाउ सेम पॉइंट्स आर गिवन इन दिस Brahma Muhurta, then timing 45 minutes after practice, you should not take anything. Then if shift duty, the stomach should be empty. If it's light of meal, then 4 hours. If heavy meals, after 6 hours. Yoga should not be practiced forcefully. Then no single kriya or no single asana should be practiced. Then I was just on this slide, if you are tired, you should not practice. Menses, they should not practice. Then about the expert yoga teacher. Then now, are you able to see this acute condition? Okay, good. You are reminded so that I could, because I won't get any idea whether you are able to see it or not. So acute condition, which are the acute condition that we'll discuss in the future slide. Then patient should, is a difference between a normal person and a diseased person. A diseased person or patient, some of the organ of the body is not functioning properly. So there you have to weigh the things very properly and give yoga module accordingly. Then it should be given progressive way and step by step as per the individual patient's capacity. And last important thing, patient should never stop any medicine while practicing yoga. Because I have seen so many over enthusiastic teachers. When a patient of diabetes comes to them, he sits over there with them. So they say, what you have got? I got diabetes. I'm taking so, and what the sugar levels are like this. Don't worry, you have come to me, now forget about diabetes. And I will get it completely cured. Then while discussion at the end, they bring the cup of tea. So the patient says, sir, I'm diabetic, so I take a sugar-free tea. So this contains sugar, so I cannot take. Hey, don't worry. I'm there now. Take that in front of me. So we'll ask him to take the tea with sugar in front of him. Then he will ask, where are the tablets? He said, yes, these are the tablets. Throw it into the dustbin. So jar hai. Take the usse. Don't take anything from tomorrow. This will not help. Because just by joining the class, patient's sugar will not come under control. He has to practice all the yoga. The body has to get modified as per the yogic kriyas, and then insulin will be secreted, sugar level will come down. So who will reduce the medicine? So let the treating doctor reduce the medicine. Now how it is possible? Now suppose a patient of diabetes or blood pressure comes to you. So he has already gone to the doctor. I told you how it is diagnosed. Usually it is accidental diagnosis. Patient gets some giddiness while walking and then he is taken to the doctor. Doctor checks his blood pressure. He says, oh, it is 200 by 100 and sugar level was 230. So that is how the diabetes or blood pressure is detected. Then what doctor does? He starts giving him medicine. So on the first day, he gives some medicine. Then he tells him, you take this and repeat your sugar after 4 or 5 days and again come and show it to me. So if that has come in under control, then he says, okay, now this is the dose, you can continue. If it doesn't come under control, what he'll see? He will increase the dose. So this trial and error will go till his sugar level comes to the normal. So then once the sugar levels come to normal or blood pressure comes to normal, then doctor will tell, now this is your regular dose of medicine, you have to continue it. And then come and show it to me after 3 months. Before coming to me, check your blood sugar and then come with the report so that I will see the report that day and if necessary, I will modify the dosing. So now how it will be effective in yogic practices? Once patient starts practicing yoga, then what will happen? Slowly, pancreas function will improve, insulin will be secreted, so sugar level will come down. So when patient will go to the doctor after 3 months, when before going he will do his blood sugar level. Now when he has done blood sugar level, when doctor sees, oh, your sugar level has come down, the fasting has come down to 90 and postprandial has come down to 100. Now I don't think you require so much dose. So I will reduce the morning dose. So let him reduce the dose. You yourself or patient himself will not reduce the dose. Similarly, when he will check his blood pressure, he will say, oh, sugar, your blood pressure has come down. It was 110 by 70. Now it has come to 90 or 100. So what we will do? We'll reduce the morning dose of the blood pressure tablet. So let him reduce. So this always remember, never forget, never. In every time, every after 3-4 slides, I'll be repeating this thing. Why? Because I want to emphasize in your mind that you don't indulge in stopping the medicine. Let his doctor decide it. So never stop any medicine while practicing yoga unless advised by the treating doctor. Now, coming to the next part, when we want to learn about diseases, we should know which part of the body is affected in a given disease. Because suppose patient comes to you and he tells you that I have got ulcerative colitis or pneumoconiosis. What you understood? nothing. But if you know that, ulcerative colitis, you get repeated loose motions and constipation, and then you have got loss of weight also. Okay. You have been given salazopirin tablet. So patient will understand that your treating yoga therapist knows the disease. If you don't know that, then what you'll see when he will tell you that I got ulcerative colitis, I have yes, okay. You will do like that. So the patient, he has gone through all the details of the disease, because this Google University is very much there, which gives you detailed knowledge of all diseases. So he has gone through all the history of the disease and he knows everything. So if you just blindly nod your neck, he understands that he doesn't know anything about the disease. If he thinks that you don't know anything about the disease, then he will also think he doesn't know disease. How is he going to treat me? So the first 50% of faith is gone. Now, whenever we are, even in allopathy practice also, when we treat the patient, the 50% is because of the faith in the doctor. You know, that is why sometimes we do give placebo tablets. Means they are not the active drug of the disease, but we give something big complex or something like that, and we say, take this, you will feel better, and patient feels better. Why? Because he has got faith in the doctor. Similarly, the patient who is coming to you, he should have full faith in you. Then 50% work will be done. And remaining 50% you give him yogic kriyas and he will be all right. So that, for that, to develop the faith, you should know the disease in detail. You should know which part of the body is affected, what are the symptoms, what are the signs, what are the investigations. And that is what I'm going to take in this part, so that you will become a definitely good yoga therapist, by which patient will develop full faith in you, and he will practice all yoga practices told by you, and he will get cured. So what are the signs, symptoms of disease? Whether the disease is acute or chronic. Now, suppose patient comes to you, or suppose somebody asks you, this patient, can you treat the patient with this yoga? So you should know whether it is acute or chronic, whether we can treat this patient, whether we can completely cure this patient, or we can. So there comes the role of the yoga as a preventive, curative, adjuvant, and palliative. So that we'll see in the next few slides. Then what are the general investigations in given disease? Suppose you get a patient of myocardial infarction, MI, or angina. Then if you say, have you done angiography, show me the picture. So you will know, you know the investigation, angiography is done, so blockages are there or not, that you will tell. Then can you cure the patient completely or not? So that you yourself have to decide in your mind. So that, and then you have to plan the yoga module perfectly. Then you must know what are the indications, contraindications, and limitations of yogic practices in each disease. This is very basic thing that you should know. Because if you don't know that whether you can give these yoga practices to this particular patient, they are contraindicated, and still you give, patient may have bad effect. So you should know whether it is indicated or not, whether it is contraindicated, as we have seen in the first few lectures. Kapalbhati, which patient you cannot give. Agnisar, which patient you, that was a general principle. Now here we'll see disease-wise principle. So then, whether yoga to be given as a preventive, curative, adjuvant, or palliative. So once all these ideas are clear, then you can plan the yoga module for the patient, because this is the homework you have to do for each and every patient. You cannot just blindly, okay, no problem, whatever disease, anything and everything under the sun can be cured by yoga. So don't worry, sit down and do the practice. Not like that. Suppose a patient of status asthmaticus is there, and if you ask him, don't go to the hospital, sit here, I will give you Ujjayi. Will you be able to give him treatment? Or whether he will get relief? Or suppose a myocardial infarction patient comes to you, heart attack. You tell him, why you want to go to the hospital and pay 10,000, 20,000 per day in ICU? Sit here, I will teach you yoga because we can get rid of blockages. So is it possible? If you ask him to sit and start practicing yoga, he will die in front of you because it is an acute condition. So these are the few things you should know. Yoga can keep yourself healthy, but there are some limitations. Not all patients can be treated with yoga. Swami Kovalananji, the founder of the Kaivaladham Yoga Institute, he said once, every therapy has its own limitation. So too is the case of yoga as applied therapy. So it has also got restriction, and that you should know perfectly. When your body system is functioning properly, you are not having any disease. But because of the modern amenities, change of lifestyle, change of food habits, it leads to pathology. Means one of the organs gets deranged, it's not functioning properly, and human physiology changes to pathology. Now, what are the diseases? Diseases may be congenital, means right from the birth. That is called inborn defect. Now, why this happens, nobody knows. But it is something to do with the genetics. Then second is acquired, means which has come after the birth, which you have acquired because of something. Now you may acquire it because of organism, means infection due to virus, bacteria, or second is the stress. The stress plays maximum role. That is why the lifestyle disorders, all the diabetes, blood pressure, heart attack, obesity, asthma, they are stress-prone diseases. That is why they are called psychosomatic disorders. The stress has got effect on the brain, hypothalamus, and there is a imbalance between the sympathetic and parasympathetic system, and that is why the disease sets in. So this is one classification. Another classification, very important from your point of view, is the acute condition, chronic condition, and acute on chronic condition. Now, what is acute condition? Acute condition means patient was all right till now. You're chit-chatting, laughing and cutting jokes, and suddenly what happens? Something happens and he is not able to carry out day-to-day routine work. So that is called acute condition. Means all his daily routine is disturbed. Now, what are those acute conditions? So we'll see one by one. Sudden severe chest pain may be due to heart attack. Patient gets sudden severe chest pain. Which side? Anybody?
Left side.
Yes, left side. Right side also can you get?
Yes, sir.
When?
Some gastric problem.
Gastric.
Yeah, but due to heart attack, can anybody get pain on the right side?
No.
I say yes. In dextrocardia, normally the heart is on the left side, but 1 in 10 lakh or something, heart may be on right side. That is called dextrocardia. So in that case, it can be on the right side. But for all practical purposes, left side is the correct answer. Okay. Now suppose patient gets severe chest pain on the left side and the pain radiating down to the left arm. Then he may get sweating. He is not able to talk. He is so much worried about the pain that he is not able to talk also. So that is usually heart attack. Then as one of you say that it may mimic the gas trouble. Now why it mimics the gas trouble? Because the heart is on the left side. Now this is the diaphragm. Below diaphragm is the stomach. And the stomach, whatever you eat, it goes there. Now the food gets digested in the stomach, it goes ahead into the small intestine, it still gets digested, and then it goes to the second part of the intestine, the small intestine, where it gets absorbed, and the remaining part goes ahead to the large intestine, colon. In colon, the gases are generated, or gas production is the side product of the improper digestion or indigestion. Now these gases, they are lighter in the weight. Now whenever gases are there, the lighter gases always will go up, isn't it? Now when the gases are produced as a side product or end product of the improper digestion or indigestion, these lighter gases, they try to go up. ऊर्ध्व गति से उनका मार्गक्रमण होता है. So what will happen? They will go up into the intestine, small intestine, and they will come into the stomach. Now when they come into the stomach, above the stomach is the esophagus. So there is no place to go. So what will happen? They will come and hit over there. Now this is the diaphragm. Below diaphragm is the stomach, and the gas is hitting over here, and above is the heart. That is why the gas trouble sometimes mimic the heart attack. So this problem usually is seen in the obese people or who are having digestion problem. They often get the gas trouble, and sometimes it mimics as a heart attack. Now suppose this patient has got a heart attack and you are his neighbor. He calls you, oh, my so-and-so relative got probably heart attack, and you told me that we have treated patients of heart attack with the help of yoga and there is no need to do surgery. So come and teach me yoga. Will you teach him? Yes or no?
No.
No.
No. Okay, good. Correct. No. But then what you will do? What you should do?
First, advise him to go to a doctor and then proceed with the reports. And later on, once he is under medication, we can suggest treatment. I mean, give yoga module.
Okay. On the day, at the time when you are called there that he has got chest pain, how you will tackle the situation? The step by step, you let me know. What you will do?
Call an ambulance.
Okay, then next.
Understand what the physician is saying is the problem from
Okay,
allopathy.
you ask for ambulance. Ambulance is coming or came. Now what is the next step?
To observe.
Yes, one of you talk. Yes.
सर अगर ब्रीदिंग ट्रबल हो तो सीपीआर देना जरूरी है.
CPR will be when patient is breathless so much that he is not able to talk and is more or less going into the unconscious type of that. There CPR is there. But he is having chest pain, he is holding the chest, he is having severe pain, he is not able to talk, perspiration is there, sweating is there, you have called the ambulance. Now what you will do next step?
सर उनको बिठाए रखना जरूरी है और वो जो टैबलेट है क्या नाम है उसको देना होगा?
वो होगी क्या आपके पास?
नहीं, उसको मंगवाना पड़ेगा अगर पास।
Okay, ठीक है, 1 point is correct. Anything else? Now ambulance has come.
Observe what the paramedic is doing. Take observation of the allopathy treatment.
Yeah. No, the ambulance has, you have called for ambulance. Ambulance has come over there. Now what is the next step? What you will do?
एम्बुलेंस में
Anybody?
लेकर हॉस्पिटल में ले जाना पड़ेगा।
How you will take him to the ambulance?
बिठाकर, सुलाना नहीं है।
बिठाकर मतलब means what?
जो ये होता है ना, उनको क्या, अरे जिस बेड पे लेके जाते हैं उस पे बिठा के,
Stretcher.
हाँ स्ट्रेचर। मेरे पापा को जब हुआ था उनको
हाँ.
बिठाने के लिए बोला था, उनको सुलाने के लिए मना किया था।
हाँ. Okay. Now I will tell you the steps which you have to follow. First thing, you have said correctly that you have to call the ambulance. Second thing, you said that that tablet has to be a sorbitrated tablet is there. So this is not possible for you because you will not get the tablet without prescription. Second thing, this is possible in a patient who is known case of heart attack and he gets severe chest pain. That time you can ask him, you are taking some tablet, where are they kept? Just get it out and give it to him. So that is possible only in the patient who is already a known case of heart attack. Now you call for the ambulance. Now about the CPR, if patient is unconscious type, then CPR is okay. But if it is conscious, is having severe chest pain, holding the chest, there is no need of giving CPR. Only thing, and since the first attack, you don't have that sorbitate tablet, you ask him to take deep breath. Second thing. Third thing, ambulance has come. Now usual mistake happens at this juncture. Because patient is so much worried, relatives also so much worried, he has got chest pain, severe heart attack, you must reach the hospital immediately. The siren, you heard that ambulance has come. So patient or relative, come on, let us run fast and go to the ambulance. They will come after 5 minutes, they will take their own time, sweet time to come here, we'll go there. And usually what happens, patient starts walking on his own. And sometimes it has seen that they are staying on the first floor and the lift was not there. So he said, okay, climb down. One floor is there. What is there? And he starts climbing down. And by the time he reaches the ambulance, he is dead. Why? Because he is already having heart attack. His chest pain, he is getting severe chest pain. And that time, if he does any kind of activity, the heart attack will be aggravated and patient will die on spot. So first thing, you will not ask him to do any movement. Second thing, if he is not having that bad breathless, you can make him lie down little propped up position. Means your head end should be little up. Third thing, suppose that ambulance fellow, they don't have stretcher or it is broken, they have just come without a, so make the patient sit on chair and lift the chair. 4 people should lift the chair and take it to the ambulance. If it is lift is not working, 4 people should carry the chair from first floor to the ground floor, but patient should not walk. Then while reaching to the hospital again, there you should see that he doesn't walk. Let the trolley come, make him lie down on the trolley, let him go to the ward, casualty. This is very important because 50% of the patient, they die. So many times you must have heard the patient had severe chest pain, he was brought to the hospital and he was declared dead. The 25%, 50% reason is that they take themselves, no, I have to reach hospital fast, so they walk. Or even relatives say, nahi, jitna jaldi pahunchenge utna acha hai. So let the patient should be handed over to the doctor, so let us go fast. Then another thing, whenever somebody gets attacked, don't have the crowded people over there. Because why there should not be crowd?
सर ऑक्सीजन की कमी हो जाएगी तो और ब्रीदिंग ट्रबल बढ़ जाएगा.
Yeah, because in one small room, suppose the patient is then suppose he has got children, so all the neighbors they come over there and they stand over there. So in one room, suppose there are 20 people, they are breathing air in and out, the oxygen level goes down and he will get less oxygen. So don't make crowded situation into the hall. Keep it very airy and wait till the ambulance comes. Let him do the deep breathing exercises. लंबा सांस लो, लंबा सांस छोड़ो, and then let him go to the hospital. If possible, and if he's an old case, you can give him sorbitrate. Otherwise, on your own, you cannot give anything. You can only ask him to do deep breathing and no exercise. No, even you must have seen that when patient is admitted in the hospital, in the ICU also, on the bed, at the head end, there is one plate, title written CBR. What is the long form of CBR? You stretch your imagination थोड़ा सा. वो जो पेशेंट का बेड रहता है उसके सर के पीछे ऐसी पार्टी लगाई रहती, CBR, कंप्लीट बेड रेस्ट. वो क्यों रहती है? Because suppose doctor has seen the patient and gone, and then other some physiotherapist comes, or the servants they come, or the sisters come, and then suppose they want to clean the blade, so they'll say, okay, get up and stand up over here, I will clean the bed. So that mistake should not happen. That's why that board is there, CBR. That means patient is not supposed to move from the bed. So there are ways and means to clean the bed or change the bed sheet. Without getting up from the bed, they change the bed sheet. Ask him to turn on this side, that side. So there are different. So CBR. So patient should be given total rest. Why total rest should be given?
Under rest, the breathing is a bit comfortable, and straining causes again pressure on the heart.
Yes, because his heart is already suffering from angina or heart attack, so it's not functioning normally. Because of the blockages, some 20%, 30% heart is not working. So the ejection factor is less, the amount of blood throwing out is less. And in that case, suppose you ask him to walk, what will happen? The demand of that blood will increase. Suppose patient is walking, so the legs will say, I want more blood. So heart will be asked to pump more blood, and that is what will happen. Heart will, under the sympathetic activity, it will start contracting fast, and it will be like whipping a tired horse. That is why I said, if patient makes a hurry or relatives makes a hurry, okay, the ambulance has come, let us go and walk and go to the ambulance. They start walking over there. Then they try to climb the stairs of that ambulance from the backside. And moment they lie down on the trolley, and when the trolley is taken out in the hospital and put in the casualty, we see the pulse and patient is dead. So he is already tired. So don't whip the tired horse. So complete bed rest. That is the ideal situation. That's why no activity. Let him get maximum air and deep breathing exercises. So this is about the heart attack. This is also because you are going to be a yoga therapist, and you will be known in your area, or he is a yoga therapist, he can treat yoga patients with yoga. So you might be called over there. So this is the first step that you should know how you should tackle a patient of heart attack. Okay. Then next we'll come to the sudden breathlessness. Now suppose a patient of asthma is there, bronchial asthma, and he is breathing like that. The wheezing sound is there. Now, if he is continuously doing like this, that means it is an acute attack. It is called status asthmaticus. Usually you will find patients of bronchial asthma, they have to take tablets every day. And some people, they carry the nebulizer or pump in their back. Why? Because they are taking tablets every day. But if there is some cloud changes, weather change, they may get an exacerbation of the attack and they may get sudden severe breathlessness. That is called status asthmaticus. Now, this is acute condition. Now, if this patient, you ask him to sit down and do the Ujjayi, why you want to go to the hospital? Sit here, I will teach you. And Ujjayi can cure the asthma. He will die because he is gasping for the air. And in that, if you ask him to do Ujjayi, he will not survive. So first thing, he has to be taken to the hospital. He should get supplementary oxygen. He should get the bronchodilator like darbepoetin, aminophylline or nebulizer. So severe sudden breathlessness. Then severe unbearable pain in abdomen. Patient was sitting comfortably, no problem was there. But suddenly he started getting severe pain in the abdomen. And he's crawling. And he's not able to talk, not do anything. It may be because of, what may be the cause?
indigestion, digestion proper नहीं हुआ इसीलिए.
Patient may not have such a bad pain. It can, if it is very bad indigestion, he may get discomfort. But so much that he is not able to talk, he is rolling in the bed.
Some stones like gallstone or kidney stone or maybe appendicitis.
Correct, you are right. Either kidney stone or gallbladder stone. That may give rise to sudden severe pain. That patient is rolling in the bed. He is not able to talk. So that also it comes under acute condition. Then severe, many loose motions in a short time. Normally, we go once or twice to the toilet in the 24 hours. But if you have to go 10 times and then the consistency is very loose, then again it is a problem because you are losing a lot of water and electrolytes. Whenever there is an electrolyte imbalance or loss of water, dehydration, if it is severe, patient may die. So it comes under acute condition. Then continuous large vomiting. Usually you don't get vomiting. But if because of some food poisoning or indigestion, you get lot of vomiting. So again, you are losing lot of water, you are losing electrolytes. So again, you may get dehydration. In both the conditions, many loose motion or many vomiting, there is loss of water, loss of electrolytes. So dehydration and electrolyte imbalance, which may lead to, patient may lead to death. So it again comes under acute condition. Then very high grade fever. Now our body has got some particular temperature. Now that temperature has to be maintained because all the organs in the body, they give their optimum function at that particular body temperature. If it increases or if it goes down, the organs cannot perform properly. That is why the temperature has to be maintained. Now, suppose because of some reason, because of the bacterial infection or because of some traumatic inflammation, you get high grade fever. So what will happen? If the temperature increases, some of the organs, they cannot function properly. There is a tripping process. As you see, whenever there is a fluctuation into the current, you get a electrical supply from the MSCB at 250 volts for our residential thing. And so there are transformers. The high voltage wire, they go through the transformer and they are converted to 250 volt, which is supplied to us. But suppose something goes wrong and that 10,000 volt electricity comes to your house, what happens?
It just bursts.
There's a tripping action and the fuse goes off and your TV, fridge, everything goes off. Why? Because at such a high electrical current, it cannot work or it cannot survive. Similarly, our body temperature has to be maintained properly. If it is not maintained properly, there is a tripping. And you must have heard that children, when they get high fever, usually the children, they should not get very high fever, above 104 or something. Because if it goes very high, that goes into the brain. The vernacular terminology used is that he had a temperature and it has gone to brain and then he has become unconscious. Now what happens there? Because there is a high temperature, the brain refuses to work. So it trips. And that is why when the messages are not coming from the brain, so patient becomes unconscious. So this is a basic principle. What you should do if the temperature goes up? Basic household remedy.
Sir, cold towel we used to place on the forehead and all.
Yes. Yeah, cold sponging should be done. So you take a cold water and put a mop into that and clean whole of the body with that. So that what will
Whole
happen?
body, yes,
Temperature.
sir.
Yeah, cold sponging that is called. So by the time you get some medicine or you go to the doctor, suppose patients, and that too it is very important in children and old people. Because these two ages, children below 10 years and old people, they are not able to cope up with the situation. That is why the high temperature goes into the brain and there is a tripping. So in these two patients, you should not permit high temperature. Then dehydration. If a child or if a old person, he gets lot of vomiting, dehydration, you cannot ignore him. He should be taken to the hospital because oral may not help. He may require a IV saline for that. So this is about the loose motion and vomiting and then fever and then unable to pass urine. Now, unable to pass urine, either it may be because of the stone into the urinary passage or in adult male patient, at the neck of the bladder, there is the prostate gland. Only in males. In ladies, the prostate gland is not there. Now, this prostate gland, if it increases in size, it will compress the urethra. The neck, bladder neck, it's situated at the bladder neck, so it will compress it and patient may not be able to pass urine. So again, it becomes acute because if he is not able to pass urine and the blood circulation is going on, kidney is filtering urine and it is coming to the bladder, so bladder will go on distending. And what is the normal capacity of the bladder? Suppose it can accommodate 5 to 700 cc of urine. If it goes above that 1000, what will happen? Patient will get discomfort and after that he will get severe pain. So again, it comes under acute condition. Then bleeding per rectum, bleeding from nose, ear, throat. Now normally we don't get bleeding from the ear, nose, throat or in motion or in urine. But if you get bleeding from any of these sites, that means you should think that there is something wrong in that part. What is the usual cause of the bleeding in this part? Anybody?
Brain hemorrhage.
Bleeding per rectum, nose, ear, throat. नाक कान घसा या मोशन में खून आता है. So what may be the reason?
Too
सर
much heat.
कौन आता है
in the-
फाइल्स की वजह से, हेमोरॉइड्स की वजह से,
Yes, hemorrhoids
और ये जो नोज और ईयर थ्रोट से आता है, ये शरीर गर्मी बढ़ने से, हीट जनरेट ज्यादा होने से आता है.
yeah, right. Any more? Any other cause? Very important.
An infection, like ear
50%.
infection. Yeah.
50% may be infection. Very important cause which you should not forget and you should not ignore.
सर वो पित्त प्रकृति ज्यादा होने से भी तो ये होता है.
Yes, पित्त प्रकृति से भी होता है, but most important is the cancer. So if anybody is getting bleeding from ear, nose, throat, or in the toilet or in urine, you should first suspect that whether he has got cancer anywhere in the body. So it should be investigated. So again, it comes under acute condition. Then excessive bleeding during menses. Now, usually ladies, they know that what is the amount of bleeding for how many days they get. Suppose it is more than that, or if they get bleeding in between the menstrual cycle, then they should think that whether there is anything wrong into the uterus. So they should undergo checking and investigation. So again, it comes under acute condition. Then unable to make body movements due to cerebral stroke. Suppose somebody gets bleeding into the brain, as somebody said just now. Then what will happen? If patient gets bleeding on the left side, he will have paralysis on the right side, because brain controls opposite side of the body. So again, if the patient gets bleeding into the brain and he is not able to make movements of the right side of the body, that means again it is an acute condition. So he should be immediately taken to the hospital. Then unable to make body movements due to accidental injury, which has caused fracture. Now, if there is any bone fracture, anything, he is not able to make movement. And such patient, again, it needs acute, it comes under acute condition and he needs medical treatment immediately. Because if patient gets fracture of any bone, then if he is not taken to the hospital, what will happen?
सर बोन अगर टूट जाता है, ज्यादा देर हो जाता है, तो उसके अंदर में जो सेल्स होते हैं, वो मतलब जुड़ने का या फिर रिपेयर होने का जो काम है वो ठीक से नहीं होगा, इसीलिए जितनी जल्दी हो सके.
Yeah, but any other reason?
Swelling, sir.
Swelling, yes. Any other?
The bone may
Patient will,
compress on the nerves, sir.
yeah, so he will get severe pain. Suppose patient gets fracture of the hand, forearm. Now, because the end is pressing on the nerve, he is not able to make movement of the arm. So he will have severe pain. Then, suppose that bone has broken, and it has also teared the muscles. There will be bleeding from the muscle. So the bleeding will increase the swelling over there. And because the bleeding has occurred, the blood into the circulation will reduce. So he will get anemia. And then the patient, suppose he gets severe anemia because of the, now this is more commonly seen in the thigh muscle bone. In the thigh bone, the muscles are pretty. So if the thigh bone is broken, lot of muscles are also torn and there is a lot of bleeding. So in one thigh muscle, thigh bone fracture, patient will lose, not means what? The blood will come into that area about, to the tune of 1 to 1.5 liter. Though it is not seen from outside, but it is there inside. The bleeding has occurred. Now this blood is not in the circulation. That is why the hemoglobin level will go down. First thing. Second thing, the normal volume of the blood is 5 liters, which is circulating into the body. Now, suppose 1 to 1.5 liter blood is accumulating into the thigh because of the fracture. So there is only 3.5 liters circulating. So his blood pressure will go down. If blood pressure goes down, what will happen?
तो सेंसलेस हो जाएगा, सर चकराएगा.
Brain will not get proper blood supply and patient may become unconscious.
Unconscious.
So again, it comes under acute condition. Then any condition which needs medical supervision, means patient is old, he has got uncontrolled diabetes, uncontrolled blood pressure, then he has got also Parkinson, Alzheimer. So he needs medical supervision. These patients, they also come on semi-acute condition. So all these acute conditions, no pathy works except allopathy in acute condition because it helps to tie over the crisis. Once the acuteness is over, means suppose that patient of acute heart attack is the chest pain, oh, I'm not able to say, he is taken to the hospital, he is given bed rest, he is the angiography done, all the medicines are given, after 8 days patient is discharged. Then what you say? Yeah, he was admitted for 10 days in ICU and he was diagnosed with a case of heart attack. Now his blood pressure, heart is settled down. He is now given some tablet and he is asked to take rest and continue his medicine. So from acute condition, he has come to a chronic condition. So status asthmaticus, patient had severe attack of breathlessness. He has taken to the hospital. He was given aminophylline drip. He was given nebulizer, and now he's settled down. He's breathing normally, and he's advised to take deriphyllin tablet, one in the morning, one to the evening, and he's comfortable. That has come into that chronic condition. So when any acute condition, the acuteness is gone, the symptoms which was warranting for anybody to get admitted in the hospital, if all those symptoms are gone, that means that patient is a chronic, means disease is still there, but he can carry on his daily day-to-day life routine. So that is a chronic. So have you understood the difference between acute and chronic? Any question?
सर chronic एक बार और बताएंगे सर?
Say, suppose you take for heart attack. He has got a severe chest pain. He was taken to the hospital. He was admitted for 10 days. He was given medicine. On the 10th-day, patient was discharged, advised to take this medicine. Now he is not having chest pain. He is comfortable. He is advised to do his routine daily at home and continue medicine. He is able to do his work on his own. The day he had attack, that time what happened? He was not able to do anything. So that was acute condition. And now he is stable. He is advised to take rest and slowly start adding his daily routine. So that is chronic stage. Status asthmaticus, Dama, when he was not able to breathe, that time it was acute stage. He was taken to the hospital. Then he was given nebulizer, injection aminophylline. His breathlessness has settled down. Now he is breathing normally. He is given tablets and he is discharged and he is told to continue this tablet. Or suppose you get again severe attack, use the nebulizer, जो pump रखते हैं ना bag में. So that has become chronic condition. Similarly, that's why I said the symptoms which were making him unable to do daily routine, and that is why he was taken to the hospital. After taking treatment, he is able to carry on his daily routine without any problem with the help of medicine. That is a chronic condition.
जी सर जी. Okay.
Okay. Anybody else? Anything else?
Sir, one question. So children, you said like when high fever
Sir, I
occurs,
have a question. Sir, during dengue,
I can't hear you proper. One by one. Mr. Chitra Mahadevan, you complete your question, then second one will ask. Okay, madam, you ask.
okay, sir, thank you. So children, if the temperature rises, they become unconscious. Some get seizures immediately. So what is the first aid to be done at home before taking to the hospital?
First thing that you have to see that his temperature should be brought down. So cold sponging should be done. Second
Okay.
thing, usually when they get seizure, मिर्गी का अटैक आता है, तो what happens? They bite their tongue.
Hmm.
So see that you put some spoon or something in between the teeth so that the bite will not occur, and take him to the hospital immediately. That much only you can do.
Okay, sir. So, will they have breathing issues? Because they usually say, I ask them to sleep, make them lie down on the left. Although, so is that
because you have to make them lie down on the left side, because when they are unconscious, the muscular sensation is not there. Now you are getting salivation 24 hours, isn't it?
yes?
But you deglute it. But when patient is unconscious, the action of deglutition swallowing is a voluntary
It's
action.
reduced.
So it is not happening.
Hmm.
So if you lie down on the back like this, what will happen? The water saliva secreted, it will trickle down into the trachea. And
Okay.
since the action of swallowing is not there, when it comes and trickles down over the vocal cord, because of the weight, it will go into the trachea. And
Okay.
patient may have asphyxia. That is why if you make him lie down on the left side, then it will trickle out from this and it will not go inside.
Okay, sir. Okay, thank you, sir.
Welcome. Yeah, somebody else was asking the question. Yes. Who was asking the question? I was not able to hear it also properly. Anybody? Or should I go to the next slide?
Sir, one question from my end.
Yeah.
Some ladies I have seen, they won't get a heart attack, but they'll get pain complete left side. I mean, through the hand and back also they are getting pain. But when they go for checkup, they are all right. The stress needs to be managed. That's what they get. So what is the reason?
If one thing is that I will give one example for that. Usually, either it may be gas trouble or it may be muscular pain. Now, gas trouble, usually you get the story like that patient gets severe chest pain like symptoms, and he said, no, I got heart attack. Come on, let us go to the doctor. They go to one doctor. He examines him. He says, oh, you have got a gas trouble. He gives some tablet and send it home. After 1 hour, again that gas is there hitting the upper part of the diaphragm and to the heart. So again he gets up after 1 or 2 hours and he says, oh, that doctor doesn't understand. I got a heart attack and he has just told me nothing. We will go to next doctor. So he go to the next doctor. Then he tells the history that I went to this doctor. Then he said, you got gas trouble. He doesn't understand. Again, I'm getting same pain. So now what this doctor does, he will take his issues. He will see, oh, good, you have come right time. You get admitted. And the one who came walking after the comment of doctor that, oh, good, you have come in on time, he will put both arms on some relatives and then slowly walk to the ICU. Why this happens? Because this is a mental setup. So either it may be gas trouble, or second thing, as you said, it may be the muscular pain. Either it may be because of the overwork, hard work, or stress. When we'll deal with the stress-prone diseases, fatigue syndrome, and that time we'll cover all these things.
Sir, I have a question.
Yeah. Yes, go ahead.
Yes, sir. Sir, during dengue fever, temperature is not coming down.
So, yes, complete the question. I'm not able to hear you. Temperature is not coming out. So what to do? That you are asking?
Sir, I wanted to ask that during dengue fever, if the temperature is 105 or 104, while giving cold press also the temperature did not matlab, is not coming down. So
Okay.
so what we can do at that time?
See, once he has been diagnosed as dengue, he must have been advised all the tablets by the doctor.
Sir, before it was not known that whether it is dengue or not. Sir, 2 days, 3 days passed. Uh, Sir, it happened with my son only. Sir, he has got 103 fever, 404, but the temperature was not coming down. So after 3 days, we diagnosed that he has dengue. But before, we were not known about it.
Now, at everybody's home, they must be having the tablet paracetamol or crucin.
Yes, sir, that only I used to give, I have given.
So, the first cold sponge and give tablet crucin and go to the doctor. So that suppose this temperature is not coming down, it is 104, 105, then he may admit him and give injection through the vein so that temperature will come down fast.
Okay.
And once
Thank you, sir.
one patient is diagnosed as a case of dengue, that time he's already given all the tablets, and then in that one tablet he has written, if patient gets fever, that should be given, and that is usually the dolo or the paracetamol. So that you can give when the temperature is high.
Okay.
And once the anti-dengue antibiotic is given, slowly the temperature will come down because the antibacterial action is there. So usually there is no problem. But if it is, when this happens, suppose patient has been given treatment, but for some high fever, thinking of it is typhoid, but then it is not typhoid, it is dengue. Then in spite of the treatment, patient fever will not come down because it is not hitting the proper diagnosis. So that case, you have to take him again to the doctor so that he will confirm whether it is typhoid or it is dengue or it is any other malaria. Because suppose it is a case of malaria and patient is getting high fever because of malaria. If anti-malarial drugs are given, then his fever will come down. But anti-malarial drugs will not act in dengue patient. So his fever will be still high. In that case, you have to go to doctor and tell him that he will see, oh, the temperature is not coming down. That means this is not malaria. So you will have to do some other medicine. So that is how you have to tackle the patient.
Thank you, sir.
Okay. So now should I go ahead? So the chronic condition, once the symptoms listed above are either gone with the treatment or become mild. That is the meaning of the chronic. Now, in any acute condition, no pathy works except allopathy. But once it becomes chronic, then you can think of giving him yoga practices. Okay. So now, about chronic diseases, I would like to talk on two diseases in detail because you will get number of patients of this particular disease. So the two are, one is the tuberculosis and another is the cancer. Now, tuberculosis, it may be infectious or it may be non-infectious. Means samsargajanya ya non-communicable. Means if the patient of tuberculosis, what is the usual, suppose you are sitting at some place and somebody say, oh, that fellow is coming, he has got TB. What is your first reaction? What you do like this? Oh, why he has come over here? Let him go to the other. And why is not wearing mask? Why you are panicky? Because you think that if he sits in this hall, we may also get tuberculosis. So this is a social stigma. So for that, what we do, that we'll see in the next slide. But it may be infectious or it may be non-infectious. Now, infectious means the patient who is breathing out tuberculous bacilli. And if he sits into the mosque, the same air is breathed in by other people and he may get tuberculosis. So that is the threat. That is why in Corona, you must be remembering that social distancing was asked. Why social distancing? Because a corona patient, when he is breathing out, he is throwing out coronavirus. And if you are standing close to him, you are breathing same air. So what will happen? The coronavirus will be inhaled by you, and then you may get the corona infection. That is why it was told first, social distancing. That means keep 6 feet distance so that by the time the virus drops down on the floor, then their concentration is less and you are breathing another air, not the same air breathed out from that person. So this is, if he is a sputum positive, means the person, TB patient, who is throwing out uh, tuberculous bacilli into this sputum, that is called sputum positive. He is dangerous. But the person who is not bringing out tuberculous bacilli, he is sputum negative. Now, this sputum test is done in all cases of TB patients, and you will get the report as sputum positive or sputum negative. So that will tell you whether he is a contagious or non-contagious. Now, in case of heart attack, patient is discharged from the hospital and advised to take daily routine, so that becomes chronic. And lastly, in cancer, the allopathy treatment like surgery is over and patient is taking either chemotherapy, radiotherapy. So these patients also, they are under chronic. Now, cancer, it doesn't give acute symptoms because cancer, we don't know why it happens, what are the causes of cancer. We don't know the cause, so we don't know the treatment. And cancer always takes a backdoor entry. And that is why usually patient doesn't come to know. When patient comes to know, it is very late. So in cancer, it is not the acute condition, it is the time of detection and then further treatment. So when patient is detected that he has got cancer, it is a high time that he should take first allopathic treatment. And once he is put on radiotherapy, chemotherapy, you can give yoga as an adjuvant therapy. You cannot cure cancer with the help of yoga. Because when we don't know the cause of the cancer, we don't know the treatment of the cancer. In allopathy, what we do? Suppose patient gets cancer of one particular part. Suppose he gets cancer over here, we chop out the hand. If he gets cancer of the stomach, we remove the stomach. If he gets the cancer of the kidney, we remove the kidney. But suppose he gets a cancer over here, we have removed hand, but some cells, they have migrated up. When we'll learn about the cancer in detail, that time I'll talk to you about in detail. So just remember this TB and cancer. Then lifestyle disorders like hypertension, diabetes, and other conditions, once they are diagnosed, they require long-term treatment. You must be knowing, suppose you have got some family member who has got diabetes or blood pressure, he has to take medicines very regularly. He cannot ignore. The timing has to be also set. Even diabetes also, patient is told that before breakfast or before lunch, he should take tablet and immediately he should take lunch, dinner. He should not skip the medicine. Why? Because if he doesn't take medicine, his sugar level may go up, his blood pressure may go up, and he may have problems. So he has to take lifelong treatment. Now these patients, you can give yoga practices. Once they have been stabilized with the help of allopathic medicine, then you can give yoga practices and slowly you may be able to curtail his doses, cut down his doses so that he will have a comfortable life. In case of stroke, patient is discharged and advised to attend physiotherapy. That means this is a chronic condition. Acute, when he have got a sudden paralysis of the right hand or right leg or right side of the body, then he was taken to the hospital, the CT scan done, they found that the brain hemorrhage is there, the treatment was given, and now he is settled down. Now only thing is that he's got a paralysis of the right hand, right leg, is not able to walk. He is given advice to do physiotherapy. Now this is the chronic stage. Here you can give yoga practices, and I have seen the patient of paralysis who came with putting both arms on the two side people and not able to walk properly. He came to our class, I gave him yoga practices, and in 3 months' time, he was able to walk on his own, only with stick, without any support, without any walker. But then he has to do it religiously. So this is about the lifestyle disorders. Now coming to these two basic diseases is very important, and tackling these patients also is very important. Just now I told you that suppose in a mob you find that patient of TB has come, the first reaction is, why he come here? Yes, he has got TB. You know that all people are sitting, he will infect all the people. You should not have called him. So it is a social stigma. And if we tell patient that you have got tuberculosis, then he will hide himself, or he will not tell that he has got tuberculosis. So what we write on the paper, on the prescription or on the case paper, we don't write tuberculosis, we write cough. You might have seen paper, or when you will treat the patient, you will get the paper like that, pulmonary cough. You will not get pulmonary tuberculosis or ileocecal cough. Why? Because patient, once you tell tuberculosis, he knows that I got tuberculosis. If I go and tell the people, they will not come with me. They will segregate me. So patient hide the thing. So we never write tuberculosis. We write cough. So when the patient of any disease comes to you, and suppose it is written intestinal cough, pulmonary cough, cervical adenitis, cox adenitis, then you should get your idea clear that it is a TB and not any other disease. But don't jump on, oh, you have got tuberculosis. If you say like that, he will run away. Because she came to know that I have got TB, so he will not come to you again. So this is first basic. We never write tuberculosis, we write cough. Second thing, cancer. When patient is diagnosed as a case of cancer, he is half dead. That's why when I will teach cancer, that will I'll tell you in detail. Cancer, C-A-N-C-E-R. Here on the R we have superimpose L, means cancel. Means patient think, अभी क्या मेरा खत्म हो गया, वीजा मिल गया मुझे. So he thinks that his life is over. So we never write cancer on the paper, we write carcinoma. Have you understood this? On the case paper, we write carcinoma or we write pox. We never write cancer or tuberculosis. And when you see the paper, don't jump and say, oh, you have got cancer. Because he is half dead. So many times when we diagnose the patient, we never tell patient that you have got cancer. But we tell to the relatives. But patient, what we say, you have got one small gland, we'll just give treatment and I think you will be all right. We don't tell him that you have cancer and cancer is incurable or abhi kuch ho nahi sakta. So when you will also get patients, you see that always these two things, tuberculosis and cancer, it is cox and carcinoma. Now what is the similarity and what are the differences between two? Tuberculosis and cancer, the similar thing is that it can happen to any part of the body. You name the part of the body and it can have tuberculosis, it can have cancer. So no part is deprived of that. Any part of the body, you must be now tuberculosis, you must be knowing only lung tuberculosis commonly, isn't it? But it can affect any part of the body. So similarly, cancer also can affect any part of the body. Then another common thing, in both the diseases, there is a loss of weight and loss of appetite. TB patient also will have loss of weight, loss of appetite. Cancer patient will also have loss of weight, loss of appetite. Appetite means भूख नहीं लगती. He will not feel like eating. Previously he used to eat 4 chapatis. Now he is able to eat only 1 chapati. So these are the common things. What are the different things? Tuberculosis can be treated and cured completely with the help of allopathic medicine, provided he takes the medicine regularly. But cancer is not curable at all. What we do, whatever part is affected by cancer, we remove that. But some cells migrate to other part and they go to that part and again they develop, and then there is a secondary, or we say cancer वापस हो गया उसको, recurrence हो गया, and then it grows again there, and then patient may die in short time. So TB can be cured completely. Cancer 90% cannot be cured completely. But if it is diagnosed at an early stage and treated, patient may have some better life. All these detail will learn into the cancer chapter in future. So these are the important aspects. TB and cancer can affect any part of the body. TB can be cured completely, but cancer cannot be cured completely. So you will get patients of these diseases also. So how you should tackle it, that we'll see tomorrow. If any question is there, you can ask. 5 minutes I'll give. Otherwise, tomorrow we'll deal with the how you have to tackle a patient of cancer or TB when he comes to you. What are the salient features of that?
So one question, sir. In case of disc prolapse or spondylosis, a sudden acute pain occurs. That's the first time for them. So immediately, if we are nearby, what will be the first aid kind of thing we have to do before taking them to the hospital? If it is cervical spondylosis, can they travel by sitting, or should we ask them to lie down? Similarly, for lumbar prolapse, disc prolapse.
They should lie down. They should avoid jerk, and they should lie down on a flat surface, hard surface, not a sponge or foam surface. Second thing, if they are traveling in the bus, in the sitting position, not bus, anything, they should support the neck with you get that modern amenities to support the neck, that they can do it. Then they should not sit on the two-wheeler, because lot of jerks, then it will be aggravated.
Okay, sir. Yeah, thank you.
Sir. Hello.
Yes, go ahead.
सर मेरे पैर में राइट लेग में स्वेलिंग हो गया है, पूरा राइट लेग, ठीक है, एकदम थाई मसल से लेके एंड तक, और घुटने में बहुत दर्द है. तो मैंने डॉक्टर को दिखाया तो बोला कि टेंडन टियर हो गया है. तो इस टाइम क्या मेरे लिए कोई एक्सरसाइज करना ठीक रहेगा कि ओनली मेडिकेशंस पे ही रहना ठीक रहेगा?
Which tendon has been teared?
ये तो उन्होंने नहीं कहा कुछ. उन्होंने देखा पूरा स्वेलिंग हुआ है, मैं मतलब पैर को मोड़ भी नहीं पा रही हूँ, राइट लेग को.
At ankle or at knee joint?
नहीं, नी जॉइंट पे है.
Knee joint, you are not able to fold the leg.
हाँ 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 हाँ.
But you had any jerking movement or something
हाँ
like
सर,
that?
एक महीना पहले मेरा एक्सीडेंट हुआ था, लेफ्ट लेग में कट हो गया था, ठीक है. तब मैं वो राइट लेग पे प्रेशर दे के चल रही थी, तब कुछ पता नहीं चला. 12 डेज से मैं दवाई ले रही हूँ, उससे पहले 10 डेज, मतलब 22 डेज से मेरा ये प्रॉब्लम हो रहा है.
Whatever prescription he has written, just send me to on my WhatsApp, and
Okay.
then we'll discuss in person. Okay.
ठीक है सर. आप
You can call me.
हम्म.
You can call me between 2 to 5 tomorrow, and send me the prescription what doctor has given. I will go through it. If X-ray is done, that also you send me, and then we can talk on phone.
ठीक है सर. सर आपका नंबर सर?
98690
98690
24
24
938.
938. Sir,
You have got the
9869024938.
yeah.
Okay.
You got my book, na?
Yes, sir. हाँ.
On the in the book on the second or third page the number is there.
ओके सर, मैंने वो ख्याल नहीं किया.
हाँ,
ठीक है सर. हाँ,
बुक
कल मैं
खोल के देखा क्या नहीं देखा अभी तक?
हाँ सर, बुक खोल के देखा है. वो तो देखना ही पड़ेगा, उसी को देख के तो चल रहे हैं अभी आगे. लेकिन मैं वो थोड़ा सा नी के लिए मैं सोची थी कि आर्थराइटिस होगा शायद, उसके लिए मैं नी मूवमेंट कर रही थी, नी कैप को टाइटनिंग, पटला मूवमेंट, फिर वो ये करना साइड वाइज, जो भी इस वैसा में हमारा नी के लिए सिखाया था वो मैं कर रही थी. लेकिन उससे कुछ नहीं हो रहा है, इसीलिए डॉक्टर के पास जाना पड़ा, तो उन्होंने ये कहा.
ठीक है,
सर.
tomorrow call me and send me the paper.
ठीक है सर, ठीक है, थैंक यू
Okay.
सर.
Anybody else?
During the menses, the female can't practice yoga, but what can they practice to keep healthy during that time?
No, when the person is having menses, that time it is spreading of the blood from the uterus. If you do practice yoga, asanas or kriyas, what happens? There is more movement of the uterus and more blood will be shed out. And if more blood goes out, the patient may develop anemia. That is why during, and as such, usually, now you also must have experienced when you get menses, that time your energy level is down.
Yes. Yeah.
In that period, if you practice yoga, what will happen? Still energy level will go down. And if more blood is shaded off, you may get anemia. That's why you should not practice.
But is there anything else we can do? Can we do pranayam, or we shouldn't do anything at all?
You can do breath awareness and shavasana you can do, or meditation.
Yeah. And I was told by one Ayurvedic doctor that during menses we shouldn't wash our hair because that stops the flow. Is that correct?
No, again, that basic question is same. If you wash your hair during menses, then what happens? You are giving more exercise to the body. So energy expenditure is more. So usually in our tradition, you are from which place?
Gujarat.
Gujarat. So in India only, na?
Yeah, but I'm born in the UK.
Okay. So in India, in the past, usually those 4 days, the ladies were not allowed to go anywhere. They were asked to sit at one place. Nowadays, it is not done. Why it was done? Because if we are going to sit at one place, not doing any activity, not going into the kitchen, nothing doing, so they are conserving the energy. Because energy level is already down. So that was the correct practice done in the past. But nowadays, nobody is following that.
Yeah. Okay. Thank you.
Welcome. See, all our traditions, Indian traditions, each and every tradition has got some important message or meaning behind it. But we don't go into details. We forget. And what we do, some of the things are done like few rituals we are following. We are not going behind it, why it is told like that. But if each and every tradition of our Indian heritage, it has got some meaning. Our ancestors, with all thought, they have started this and they are following it. So this is one of that. During 4 days of menses, you are not supposed to go anywhere in the house. You have to just sit segregated and no activity at all. Anybody else? Or we'll find another thing important. Tomorrow, I'm planning to take the lecture at 7 o'clock. You have got the message?
Yes, sir.
So tomorrow,
Yes. Yeah.
tomorrow we'll do it at 7. And another question what I wanted to ask you, that every Sunday, would you like to have at 7 o'clock or 7:30 only? Because if you get free by 8:30, you can, Sunday, some people have to go out to do something that. So if you are interested, every Sunday we'll take at 7 o'clock. That you think and convey the message to Dr. Jagdish ji.
सर मुझे कोई प्रॉब्लम नहीं है.
No, it is not your own problem. It has all the people have to decide. Majority will work. Otherwise, we'll continue 7:30. But for tomorrow, it is personal request for myself. I have got some work. That's why I want to have a lecture, get over by 8:30 or 8:25. So tomorrow I am taking at 7. But if all are agreeing, then we may take it every Sunday 7 o'clock, or then otherwise we'll continue 7:30 only. So individually, you can send message to Dr. Jagdish Naik and he will take the decision. Anything else?
When we're practicing Anulom Vilom, is it the same? The food has to be fully digested by that time, so 5 to 6 hours, the same as asana practice.
Yeah, same. Any kriya or asana, the stomach should be empty.
Even though Anulom Vilom is quite basic, even
Yes,
then.
even then also. Because you are doing deep breathing, na? Deep inhalation, deep exhalation. So your stomach should be empty.
सर हाँ, एक क्वेश्चन है अनुलोम विलोम